vibes. In this video we shall study about the IV cannula.
Another most commonly done things by interns is doing the IV cannula, the IV channel, what we call. So we have got many gel codes, many colored gel codes over here. There are some other colors also which are not available at the moment. Most commonly we use the pink gel coat. Pink gel coat we use in the medicine wards. This is for IV infusion, drugs. This is for that demonstration, infusion. After that we have the bigger size, that is we have our gauge number written over here. This is the green cannula. The green cannula is usually given when you have to transfuse more amount of blood, more amount of fluid to the patient. So we have in trauma department or in surgery department, in gynae, in anesthesia, we use this green cannula. And bigger than that we have the orange, also the grey cannula, which we will rarely get to see in the ward. So most commonly we use pink
the medicine ward, what we
green.
usually use is pink and green, 20 and 18. Those are the commonly used cannulas.
Yes.
Right?
This bigger the gauge, smaller is the needle. Okay.
In
After
the
that,
pediatrics ward, you will be getting to see yellow gel codes. Those are 24 G. Those have a very narrow board for administering small amount of drugs into the pediatric population. Okay. So depending on your necessity, you will be choosing your IV cannula.
These are the 7 types of IV cannulas which are usually used. Each IV cannula has got a separate color, which indicates that each one of them have a separate gauge size, different diameter, different length and different flow rate. Now you have to know the gauge size, the uses and the color code for each IV cannula. As you go from top to bottom, the gauge size increases and the length, external diameter and the flow rate decrease. Only one thing increase, that is the gauge size, other 3 will decrease. Now the mnemonic is OG, Golgappa Pani Puri Banao, Yaha Paroso. O stands for orange, that is 14 gauge. The first G stands for grey, that is 16 gauge. With each color you are going to add 2 gauges. Okay. Golgappa, that is again G, 18 gauge. Paroso, Pani Puri, 20 gauge, that is pink. Banao, 22 gauge, that is blue. Then is Yaha, 24 gauge, yellow. Paroso, 26 gauge, that is purple. Now let me tell you the uses of each of these IV cannula. The first one, that is orange, that is used in trauma department, surgery and rapid blood transfusion, or where rapid fluid transfusion is required. Then is the grey and then green. These 3 almost have similar uses, that is in the trauma department and in those departments where rapid blood transfusion or rapid fluid replacement is needed. Next is the pink IV cannula or the pink gel co, that is used in most of the infusions, most of the routine blood infusions, and this is the commonly used IV cannula in the medicine ward. Then is the blue, that is used for older adults, for routine blood transfusion, for most of the transfusions in older adults. Now yellow is the IV cannula that is used for pediatrics, neonates, adults, older adults, for blood transfusion and for routine infusions. And lastly, purple is specifically used only for the pediatric or the neonate age group for any blood infusion or blood transfusion or any kind of infusion. This is all about the IV cannula, the gauge size, the uses and the color coding is very important. These are the parts of IV cannula. The most important that you will have to remember is the flashback chamber, the needle and the valve and the color coding.